Morning at the Urban Training Center here in southern Indiana. We're going to interview a doctor who got my attention yesterday when he started talking about hearing in dogs. My retired dog that I have currently at the house, if I yell to him and call his name, he looks the other way, and I thought, well, that's bizarre. What's something going on with his hearing, but I'm not sure what. So we're going to talk to the doctor and he'll introduce himself, and forgive me for not pronouncing his name. I don't want to do it and butcher it. So we're going to talk to him and let him take the microphone, take the video, and tell us a little bit about what he does and why he's there. And I'll turn it over to you, sir. Thank you very much.
Thank you. So I'm Dr. Pete Scheifele. I teach in the medical school at the University of Cincinnati and in the audiology and speech pathology departments. My lab, which is known as Fetch Lab, I started because we do a lot of work with audiology and of course with human patients, but I got a call from the Army some time ago, Army Research Office, about helping out dogs that are working dogs, whether they are military or police, keeping the dogs on the job by keeping their hearing up, because the dogs are exposed to everything from gunfire to flashbangs, explosives, and so the dogs prior to this time were not being hearing tested. Hearing testing in animals is relatively new, and I got interested in it as a former military member in the Navy. I got interested in it because we need to keep these guys working, and so audiology is a big part of it. I always preface things by saying that audiology is not the first thing that people think of when they're thinking of health. In fact, as humans, it's rare that we think about audiology when we're adults until the day comes that we are not hearing anymore, and or people are saying that they're tired of repeating things to us, and so then we go in maybe and have a hearing test, and then by that time it's time to have hearing aids or whatever.
I know that feeling, doctor.
So the thing to know is that dogs suffer the same kinds of hearing loss exactly as human beings, whether it's deafness with age, which we call presbycusis, whether it's auditory hallucinations as a result of traumatic brain injury or otherwise. The dog suffers the same kinds of consequences as we would. My lab is one of the only places in the world that actually fits dogs with canine hearing aids. So, but the problem is that usually by the time a person, an owner, breeder, recognizes that their dog is not hearing, is not getting up when they come home, or not responding to the food dish or whatever like that, the dog's hearing usually is so far gone that a hearing aid or anything else is not going to work for it. The dog will be what it is. It'll either be deaf or have a very severe hearing loss. So with the police here and with the military, we started to do baseline testing on the dogs so that we can tell approximately what the left and right ear were doing for each individual dog based upon their age, their gender, what kind of a job they have, and so on and so forth. And now that we keep those kind of statistics, as an instance, if a police dog goes out, we have a baseline, we know what the dog's hearing level is, or at least the threshold at some point in time in their life. They go out and they go on a mission, or they go to the range and they're practicing shooting, and the dog is there. The dog comes back, and now we test it again, and we can see that the hearing threshold has been elevated. So the dog has temporarily lost a bit of its hearing, and then we can track it when that hearing starts to go back down and becomes normal, or if it doesn't go back down and become normal, and we know that we now have another issue to deal with. As an example, some of our military members that fly the dogs in helicopters, the helicopter is very noisy. Every person on board that's on the chopper has to wear hearing protection by federal law. in many cases in the past, the dogs did not wear any hearing protection. And so when in training, when they came off of the helicopter and got out, if the handler is now trying to give a verbal command to the dog cannot hear the verbal command. And so there's no response. Same thing would go here if you have a SWAT team or a police team that's doing something, or they're just even going to the range and shooting 500 rounds. The dog will have a threshold shift. It won't take verbal commands very well, if at all. And so we want to make sure that we can keep these guys operating by paying attention to their hearing and doing what we can to remedy that before the hearing loss becomes profound deafness. So that's what we do. We see everything from puppies to whatever. Typically we work with dogs, but we are also working with elephants, cheetahs, lions, walruses, and dolphins in various different aquaria and zoos, and also in South Africa. We're trying to help there where the elephants, the people are living longer, and so they're farming and they're taking away a lot of the area that the elephants inhabited. The elephants will come back in and rampage villages or take over the crops, so we're trying to find a remedy for that. So we do a wide variety of things. But here at the Urban Training Center with our police force, our number one job is keep the dogs hearing well, train the handlers to look at the signs and know when the dog is not responding, that maybe there is an issue, a hearing problem. Or as you just said a little while ago, we know that if a human or a dog has a hearing loss in one ear and they are sitting in noise, for instance, and this happens to a lot of people that have hearing aids, if they have a loss in one ear, they turn off the hearing aid, they're in a restaurant and it's noisy, they will not be able to localize where the source of the sound is coming from. And so the dog will look around, look in other directions or whatever, because he can't figure out exactly where it is. So this is all kind of new stuff, but I think that hopefully we're going to help the handlers out with new knowledge and also keep the dogs safe.
Awesome stuff. Do you think, back to the police and military dogs, and the loss of hearing and inability to locate where the sound is coming from, is that a case that it could be in both ears or just one, or either or? That's one question.
I think it's either or. I mean,
Yeah.
if the dog has a loss in one ear, then any kind of background noise is going to confound that dog not knowing where the sound came from. As an example, we've tested a number of herding dogs that are in competition, and either they lose the ability to hear the specific frequency of the whistle that the handler is using to guide them, or if the dog becomes has a hearing loss in one ear, they might hear the whistle, but they're not sure whether it's a left, right, stop, or where the whistle, where that sound came from. But if the loss is significant in both ears, then they'll be totally confounded because they have nothing to go on.
Sounds like me. I'm totally confounded at times.
I think many of us are.
Yeah. So another question I had for you, and I don't want to keep you too long. Do you find that most of it is environmental things that have happened to the dog over the career, or could it be genetic contributed as well?
That's a good question, and the short answer is yes, all of the above. Mm-hmm. In this day and age, we routinely, and every Friday in my lab at the university, test puppies. And the reason is because when Walt Disney came out with 101 Dalmatians, everybody wanted a Dalmatian. And so breeders started breeding, but there was a lack of attention to how the dogs were bred. Consequently, just like hip dysplasia or eye problems, consequently the dogs started to come down as a congenital thing with congenital deafness. That is, the puppies were born deaf. Right now, there are 80 breeds of dogs in the United States that have congenital deafness issues.
And many in between, correct?
And many in between. And I can tell you that, at least in the United States, 1 out of 5 Dalmatians will be born deaf. And so now they come to get tested because we want the breeders to not breed a dog that has a hearing problem with another dog that either has a hearing problem or doesn't, because they're going to breed deaf puppies. In the case of older dogs that are just losing their hearing, then usually it's an environmental thing. So for a human, we go every day, and our hearing threshold goes up and down. If you're exposed to noise, your hearing threshold goes up. You don't hear as well as most times you don't even know it, but sometimes you do. I mean, if you go to a, I hate to show my age or anything, but being a young fella that went to Jimi Hendrix concerts.
Me too. I saw him in concert.
There you go. I mean, you
We're
come out of
brothers in rock.
you come out of the concert and you have a fullness in your ear and you don't really hear as well. That's a temporary threshold shift. Now, will it go away? Yeah, it'll vary for different people. I might recover in an hour, or you might recover not till the next day or whatever like that. Point is with that is it's a temporary shift. However, you have done damage to the ear. So a person that works in a factory that doesn't wear hearing protection, they come out just like going to a concert with a fullness in their ear, but they do this every day. After 10 years, the shift becomes permanent, and now they're deaf and they can never hear again. So that's one of the things that we want to keep these dogs from having happen. We want to make sure that we're not exposing them so many times in such a close span of time that eventually the ear is just going to terminate itself and it won't be able be able to hear anymore. But it is a lot of it is environmental, and this is where, especially for our guys, our police and our military guys, because there's gunfire, because there's impulse noise. The other thing is, and I've been doing a lot of work now for the Department of Defense with kennels. Kennels are built to be clean, and heretofore we never worry about whether or not the kennel is noise proof. And so consequently, you put a bunch of dogs in a kennel, and it'll go up and down, but at various periods during the day there'll be a lot of barking. Some of these kennels that I've been to, by federal law, the handlers can't even be in that kennel without hearing protection, because the noise is too loud. It goes against federal regulations.
You don't think about that often.
So if you're kenneling a dog and it's a working dog, and then you take it out and it comes out, and now you're going to expect to work with it, much less put it down on the range under gunfire or something like that. The dog already has a threshold shift. Now you're adding to that and making it worse. So we're trying to mitigate noise in the kennels, bring the kennels down so that they're not only clean and washable, but they're actually able to keep these dogs hearing good. And it goes a lot. If a dog is in the kennel, and we see this in civilian kennels, if a dog is exposed in a kennel where there's a lot of barking and the reverberation is bringing all this sound back to them, they're not calm. They're gonna be dicey. They're gonna be and so we can do a lot to even just calm the dog down by putting it in an environment that, hey, when you're here and you're gonna rest, it's not gonna be 100 decibels that is gonna cause you to go crazy.
Well, I don't want to keep you too much longer, because I know we have close to 200 dog teams here. And I know you have a big day ahead of you testing dogs. But I have one quick human question for you. My wife always says I have selective hearing. Now, is there such a thing? And just give me a 2-second answer to that question.
Well, this is a common thing with wives and husbands, I have to tell you, but it is true with dogs too. Selective hearing, obviously means that you're not going to listen to what you don't want to listen to, and that goes for for any animal. And I will tell you that.
And quickly to interrupt you, and I don't mean to.
No, go ahead.
So because we hear things that we want to hear and hear things that we may not want to hear, is that more of a tone thing as opposed to a hearing thing?
It's partially the sound itself, meaning the frequency and intensity, but it's also partially intelligibility. If you have something that somebody is telling you and you know that you have to intelligibly be able to interpret that, then that's where your mind's focus is going to be. And that's where your auditory system is going to be looking, because you need that information, and anything else you're going to separate. I guess we could end with a kind of a funny story that we see, and my students who are all audiologists, we see people that come in, and the guys, this is mostly a guy thing. So this goes to the wife.
Can you even say that in today's current culture? A guy thing?
I don't know, but I did.
We're going to let you say it. We're going to let you say it.
But here's what happens. I would say that probably half of the men that come into the clinic to get a hearing test will come in and say, I just came down to get a hearing test because my wife told me I had to come down here because she's tired of repeating herself to me, and that's why the men show up. Other than that, it's usually a work situation where people come in and they feel like, you know, whether they're musicians and they're in a band or whether they're working in a factory situation, they're in a high noise level all the time, and so the hearing starts to go. But again, most people don't recognize it until it's too late. And certainly with dogs, whether it's a working dog or not, we're not trained to watch and say, I wonder why the dog is doing this. Maybe he can't hear, because we'll have a tendency to say, well, it's something over here, or it's this or that. Hearing usually is at the bottom of the pile. But we want to raise it up and make people aware that you can really spare your dog a lot of time and effort and keep them on the job longer if you pay attention to their hearing.
Awesome information, and I thank you so much for everything. God bless you.
Hey, brother.
And we're going to try to get back here and see the
hearing test?
actual hands-on.
Yep.
Yeah. So
you're most welcome.
Yep. All right. Thank you, dude. That was awesome. I'm telling you.